National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. One of the things that often people present in my office with is GERD, or gastroesophageal reflux disease, more commonly known as indigestion or heartburn. Basically, this condition occurs when stomach acid refluxes or travels up the esophagus, creating burning and inflammation. And it is a very serious condition because with long-term inflammation, you can get changes to the esophagus called Barrett's esophagus that can eventually develop into esophageal cancer. So it's really important if you suffer from GERD or suffer from chronic heartburn that you get it under control, and more important than just managing the symptoms. So ways to do that are identifying the food triggers. You know, there's a lot of different foods that are associated with causing heartburn. Things, of course, like alcohol, excessive amounts of caffeinated drinks, so colas, coffee, sometimes tea can even cause it, as well as spicy foods can irritate heartburn and irritate GERD. And then certain foods for some people, I've seen a variety of patients where it's triggered actually by overconsumption of dairy products, or in some cases overconsumption of bread and flour products. So if those are your triggers, look at trying to reduce their intake to help control your symptoms. Now, one of the most important things to understand about GERD is that it can actually be triggered by either high or low stomach acid levels. So if it's the easiest way to figure this out is by doing something called a burp test. Basically, you drink a 1/4 teaspoon of baking soda first thing in the morning and time how long it takes you to burp. It's the old acid-base reaction. You know, if you were creating a volcano for your grade 4 science experiment, you would use this same principle, because what happens when acid, your stomach acid, meets the baking soda, it should react causing gas, causing you to burp. If you don't burp, that means you have no stomach acid. So that's a good identifier that your stomach acid levels are likely low, and that can trigger GERD. And the reason behind that is because in your stomach, the exit to your stomach opens in response to stomach acid. So if you don't have adequate stomach acid, the actual valve won't open the way it's supposed to, and that traps all the food and the stomach acid in your stomach. The other thing is the valve at the top of your stomach that enters into your esophagus, it closes in response to acid as well. So it stays open, allowing then acid to reflux up into the esophagus, creating problems. This is why it's so important that we get that under control. So if you do have low stomach acid, one of the things I recommend supplementing with is apple cider vinegar or betaine HCl, which is essentially stomach acid pills. This actually helps to restore the normal stomach acid levels, allowing for the proper flow of food out of the stomach into the intestines, preventing it from refluxing back up into your esophagus. I know it seems strange to actually treat, a heartburn or an acid problem with acid, but if your problem is due to low stomach acid, it is going to be the most effective therapy. Now, if you burp instantly when you take that baking soda and water drink, that means you probably have too high a stomach acid, and you need to actually control that. And ways to do that is you can actually use something called DGL, or deglycerinized licorice. It's a special form of licorice that has a chemical in it removed that may cause high blood pressure. So this makes it safe to take very high amounts of this licorice without the risk of the high blood pressure side effect. So DGL, very effective way to help manage the excessive stomach acid. It basically helps to produce a coating that prevents the acid from burning your esophagus and burning your stomach. Other things that you can use is a herb called slippery elm. Again, it has a lot of what we call mucilage, so it actually helps produce a mucus coating that prevents that elevated stomach acid from burning your esophagus and burning your stomach. So those are some ways to help control the elevated stomach acid, as well as look into your medications, as many medication side effects can actually cause this problem. And if it is a medication that's causing it, speak with your doctor about possibly finding a substitute medication or changing medications to one that you may tolerate a little bit better. So I hope this video has helped you understand your heartburn symptoms a little better. Check out more of our natural health videos, subscribe, and if you have any questions or comments, post them below, and always remember, knowledge is health.